Hello, and welcome to another episode of In Plain Sight with me, David McCaffrey. Now, I didn't intend this to be a third part of a series because the first two parts that were released on COVID and subsequent vaccinations, because it is gaining traction in the media and particularly on social media again. This was never intended to be a third part of it. But after I thought about it and I'd written it, I figured it actually made sense to make it. So today, I'm going to tackle one of the most emotionally loaded phrases of the post pandemic world: excess deaths. Now, it gets thrown around a lot online, especially on social media, as if it proves one thing, and it usually concerns vaccines, sometimes lockdowns, sometimes cover ups, sometimes all three things at once. But excess deaths are real numbers often used in unreal ways. So today I'm trying to separate the data from the agenda because numbers do matter, but only when they're understood properly. So what are excess deaths? Well, excess deaths are not mysterious, not at all. They simply mean that more people died than expected compared with historical averages. That is essentially it. It can be based on a number of factors, but usually it's based on previous year's data, age adjusted trends. Sometimes seasonal patterns can come into play, and sometimes population changes can be a factor as well. It doesn't automatically tell you why these things occurred. And that's the first deception that you'll find online. People treat excess deaths as a diagnosis, and they're not. They're not. They're an alarm bell, but that is all they are. They're not a diagnosis. And that leads us to another question: why can excess deaths rise? Well, there's a number of reasons. It can be because of delayed healthcare. During and after COVID, there were missed cancer diagnoses, there were postponed operations, there were untreated heart disease and other conditions, there were delayed presentations, and there was many, many more factors as well. Secondly, we have an aging population. And older populations naturally create higher mortality pressures. That is just a fact. And thirdly, respiratory illnesses. Alongside everything else that we have, COVID never fully vanished after the pandemic, nor did flu, nor did RSV pressures. They still existed. COVID just added onto them. There was also a chronic disease backlog: diabetes, obesity, cardiovascular disease, vascular disease. There were drug deaths, alcohol harms, mental health fallouts, heat waves, cold snaps. Mortality shifts every single year. And ONS data repeatedly shows all of these multiple interacting factors at any one time. Now, a lot of people say, so it must be vaccines then. But no, that's not true. That's an ideological jump ahead of the evidence. If someone sees excess deaths and immediately says vaccines, consider asking, what are the age groups? What's the cause of death? What country? What year? Compared with what baseline are you using? What confounders were you adjusting for? Most viral posts never answer these questions whatsoever because they're simply not analyzing the data. They're simply campaigning for clicks and likes and money on the back of their rhetoric. Now, it's important to say, could vaccines cause some harm? Yes. Yes, they could. Yes, they have. Yes, they can. As with all medical interventions, there are serious harms that occur. Rarely in the grand scheme of things, but they occur. That is already publicly acknowledged. Rare adverse events and population-level excess mortality waves are not the same thing. Those require different evidence standards. You can't use anecdotal data to explain national mortality patterns. It just doesn't add up. And there's a reason why all of this matters. If you wrongly blame everything on vaccines, especially since the pandemic, real causes can get ignored. Health systems then avoid scrutiny, chronic disease trends can be missed, delayed care deaths are subsequently minimized, and public trust worsens. That we do know. And if governments dismiss all of these concerns as nonsense, conversely, skepticism grows. Injured individuals feel erased and ignored, and cynicism deepens. Again, I said this on the last two episodes. Some people are wrong. Some people are half right for the wrong reasons. And some institutions just tell the truth badly. So what's the real question? Well, from my perspective, the question isn't what proves my side of the argument. The question should be what combination of factors best explains the evidence? And that is significantly harder for people to accept, understand, and present because it's less emotional. It's definitely less profitable. But this is how adults and healthcare workers and citizens of the planet should approach public health all the time. Excess deaths deserve investigation. They demand it. They require it. They don't deserve exploitation, which is what a lot of them get. Numbers are not sacred. They can be cherry-picked. They can be stripped of context. They can definitely be weaponized, and they are. And truth is slower than outrage. But you know what? It lasts longer. As always, be well, stay safe. I'm David McCaffrey, and this is In Plain Sight.